United States has arguably one of the best healthcare systems in the world. It also has the most convoluted value chain.
Define system.
From innovation to the patient.
Okay.
Okay, if you look at what we have more new drugs and therapies available for patients than any other country in the world, okay, hands down.
We're really good at stuff.
We are really good at creating stuff. We are not really good at managing costs along the value chain, and we have in our free market systems created so many levels of cost in that value chain.
We've
that
doubled the cost of providing services.
we created problems. For our innovators, designing with reimbursement in mind from the beginning is something that we need to do a better job of teaching. Jason, would you agree with that?
I absolutely agree.
And I can speak for my own ecosystem where I have a PhD that does nothing but work with our entrepreneurs on the nuts and bolts of running a business and the things that they have to look at, which includes reimbursement, quality management systems, which, by the way, you have a quality management problem and the FDA shuts you down if you're a small business, you don't recover. So those are things that we really focus on in between the exciting things that everybody wants to talk about. But the reality is if you don't know how to block and tackle, okay, or using an equine example, if you start knocking down gates, you're not going to win the race. And so, all of those things, it is a very different, and I came out of semiconductor. Okay, what we are dealing with now in this revolution for biotechnology is completely different. But it truly does have the ability to change our global way of life if we figure out how to do it right.